Good afternoon, everyone. Excuse me. My name's Andrew Rand. I'm this afternoon's host. As chairman of the Peoria County Board, I'd like to welcome you back, our listeners at home, and of course, our good friends here in the media who are doing their best to help us get our messages out. I'm also representing our mayor, Jim Ardis, Chairman Krug from Woodford County, and Chairman Zimmerman from Tazewell County, as all four governments have been coordinating their efforts together. I think it's easy to say that sheltering in place and maintaining safe physical distance from one another has become a longer process than everyone wanted, but we must grind it out until we all reach the finish line at the same time. You're going to hear from a couple of folks today whom I've worked with professionally for almost 30 years. The director of the Emergency Communications Center here in Peoria, David Tuttle, and the chief of the Peoria Fire Department, Chief Tony Ardis, about their activities and responsibilities as first responders, something I have a little familiarity with too. And what's super important to remind everyone of is our first responders are still taking care of regular people, folks that get sick, folks that don't feel good, folks that need access to emergency care. And that starts often by calling 911, and then a series of responders are engaged based on the kind of emergency you're having. The Emergency Communications Center's job is to sort through the messages they receive in the dispatch center and send us the right team of first responders, and the first responders rely on that information. And while we're all doing this, we're all trying to make sure we have operational continuity. That is, that our people can go to and from work and provide services to the community without spreading the disease itself or contracting the disease. And I think you may hear a little bit about that today. So I hope you give them the time and attention they deserve. They're doing an extremely good job, but they always do an extremely good job, and I'm proud to work with them. Before you hear from them, though, Monica Hendrickson, the director of the City County Health Department, has some updates. Thank you.
Good afternoon. We begin today's briefing with the to-date totals as of Thursday, April 16th. The Tri-County region is reporting 66 cases to date. Peoria County reporting 34, Woodford County reporting 11, and Tazewell County reporting 21 cases. The total number of deaths remain at 4. The hospital systems of OSF St. Francis Medical Center, Union Point Health Proctor, Union Point Health Methodist, and Union Point Health Pekin report ICU beds in use as currently 19, of which 8 are for individuals confirmed with COVID-19 and 11 for persons under investigation. In addition, they are reporting 23 non-ICU beds in use for either confirmed or persons under investigation for COVID-19. For Peoria County specifically, of the 34 cases confirmed, 65% are females and 35% are male. The racial demographics fall at 65% white, 24% black, and 11% either other or unknown. The age of confirmed cases ranges from 20 to 99, with over 70% of them within the age ranges of 30 to 39 and 50 to 69. In regards to the confirmed cases in Peoria County, 13 have recovered, 16 are at home and isolating, and 4 are currently hospitalized. This week is National Public Safety Telecommunicators Week, which strives to acknowledge the link of our dispatchers provide to us, the citizens and residents of our community, with the valuable and life-saving services that we require. The Joint Emergency Operations Center between the county and the city for our COVID-19 response early identified the essential role they play, along with our fire departments, our ambulance services, and our dispatch services and law enforcement in protecting the health and safety of our community. To speak more to this, I'd like to introduce the City of Peoria Fire Chief, Tony Ardis.
Thank you, Monica. I'd like to start out with some thank yous, if you guys don't mind. First off, Chairman Rand, Mayor Ardis, Chairman Krug, and Chairman Zimmerman for their leadership throughout this event. Public Health Director Monica Hendrickson and her staff, the job they are doing is absolutely incredible. And you all have become familiar with Monica during these news briefings. We've worked with Monica for many, many years, and she has always been so engaged and so important. The latest being with her incredible work with the opioid addiction crisis, and the work there was just incredible. The entire staff of Advanced Medical Transport, they're our partners. We work together closely on the streets every day, and the job they have done throughout this ordeal and literally every day is unbelievable. Our Battalion Chief of EMS, Roland Tenley, he has been a tireless advocate of EMS, and he has been an invaluable asset throughout this whole process. The two guys behind the scenes, Jason Marks and Mike Vaughn, with the county OEM and city OEM respectively, they have done an incredible job. And then last but not least, Dr. Matt Jackson, whose steady, knowledgeable leadership has helped us immensely traverse through this very difficult time. And then also, of course, Director Tuttle, who you'll be speaking or hearing from after this, and his wonderful dispatchers. As I mentioned, Dr. Jackson, he's a heavily engaged, very hands-on medical director, and he set the stage on March 10th with establishing what's called Protocol 36, which I believe Director Tuttle will talk about. What it basically is a series of questions that the dispatchers ask that trigger a probable or possible COVID call. And that was very important for us as far as response goes. We developed internally on the fire department a plan for a one paramedic quick response vehicle. We did this for three reasons. One was to minimize the exposure to our personnel. Secondly was to hopefully free up our partners with AMT because heart attacks, strokes, broken hips, all of those things are still taking place. And then lastly, to keep our machines in service for higher acuity calls and fires. And again, that was put in place, or that was planned on early in March. BC Tinley, Battalion Chief Tinley of EMS, we talked about him earlier. He created an idea of using Station 17, which is our training annex on Skyline Road, in the event we were going to have to quarantine any of our personnel. It was a wonderful idea, and he and Division Chief of Training Mike Morgan worked tirelessly getting that facility up and ready to go. On March 18th, we did have 3 members who responded to came in as a respiratory distress call. After the fact, we all learned that the patient had been suffering from a fever, chills, and respiratory distress. By that time, our members had already been exposed, and so they were placed in quarantine at Station 17 for a total of 5 days. Fortunately, that patient, the COVID test came back negative. On March 19th was our first day of implementing the quick response vehicle. Again, that is one paramedic, and they are dedicated to responding to all COVID, to all Protocol 36 incidents. And they are in complete Tyvek uniforms and completely encapsulated. Battalion Chief Tinley's conducted over 7 Skype sessions with our crew members. Because this is an ever-evolving situation, things are changing rapidly, and again, he's done a wonderful job working with not only Monica but Dr. Jackson, ensuring that our personnel are completely up to speed. I can't say enough about our membership, the crews on the street. This is a tough situation. Again, things are changing rapidly, and they have taken it all in stride. They've worked hand in hand with our partners from AMT, and it's been very nice to see. The last part of our change in response is when our members respond to a call of flu-like symptoms, even though they don't reach the Protocol 36 level, we are keeping one member at the door to get a visual on the patient. And we always put it in terms of sick, not sick. We can tell as soon as we visualize a patient if they are in need of immediate medical intervention, and if that's the case, then the other 2 members will come in. If we determine they're not sick It doesn't mean they don't need help. It just means that they are stable, and what we try to do is get them out of the residence, again, to minimize the exposure. That's pretty much what we've done thus far. Things have worked very well from the top to the bottom. Just a couple things in closing. One is, and I know it's not relevant to the COVID situation entirely, but there is no burning. You are not allowed to burn in the city of Peoria. There are a lot of people with allergies right now, obviously pulmonary issues, and besides being illegal, it's not helpful to your neighbors. So please be mindful of that and remember that there is no open burning in the city of Peoria. And then the last message is Dr. Bender is doing an incredible job, and the message he delivered yesterday was so vitally important regarding mental health. We know that this is a very difficult time for everyone. Everybody's struggling, and it's not only important to take care of yourself physically, but mental health is just as important. And the message he delivered yesterday was just outstanding. And we just ask everybody to take care of each other, take care of yourselves, and please don't make a permanent decision based on a temporary problem. Thank you very much. I would like to introduce the Director of the Emergency Communications Center, David Tuttle.
Thank you, Chief Ardis. I'm David Tuttle, manager of the Peoria Emergency Communications Center. As Monica said, this week marks the observance of National Public Safety Telecommunicators Week in the United States. I'd first like to thank our first responder 911 dispatchers in Peoria, Bartonville, and the dispatchers at Advanced Medical Transport, TC3 in Tazewell County, and Woodcomb in Woodford County for the outstanding service that they provide to our communities, not only during this time, but all the time. I'd also like to thank the folks at 211, which is housed at AMT, who are doing an outstanding job of assisting the public and have taken an enormous amount of the burden off the 911 system by being able to answer questions of callers that were concerned about their condition. Can't say enough about 211 and the role that it has played during this time. Each day in Peoria County, over 325 911 calls are placed to our dispatch centers. In addition, there's over 600 non-emergency calls. I'd also like to remind you that text to 911 is available in Peoria County. If you're unable to make a voice call, text to 911 is a valuable method to get help. During the COVID-19 pandemic, the 911 dispatchers have been tasked with asking additional questions of callers on all emergency and non-emergency calls. The sole purpose of these questions is to keep our responders safe. For citizens calling 911 for a medical emergency, the dispatchers are asking two sets of questions on every call. Does the patient have fever or chills? Does the patient have trouble breathing or a cough? If they answer yes to either sets of these questions, then they go to the flu card, which is Protocol 36, which Chief Ardis talked about. The dispatchers will also ask if anyone in the home is sick or has been sick. We use the Priority Dispatch medical prioritization system. If the callers, as I said, answer yes to either one of those two sets of questions, we go to that Protocol 36, which is the flu pandemic response. As the callers answer each question, we determine the appropriate fire and medical response. There are 3 levels for this response card: level 1, level 2, and 3. We are presently at level 2. We hope that we don't get to level 3. Dispatchers work under the medical direction of Dr. Matt Jackson at Peoria Area EMS at OSF St. Francis Medical Center. The level of the system, where the system is at, is determined solely by Dr. Jackson based on a lot of different parameters. It's also critical that the callers be truthful and forthright when calling 911 for an emergency. We ask callers to answer the dispatcher's questions and provide health information not only for the patient, but the other folks living inside the house or in the business. This allows the dispatchers to provide information to the first responders, which keeps them safe. Asking these additional questions and getting the responses really takes very little time. I'd also like to point out that some non-emergency police calls, such as an earlier theft, earlier vandalism, those are being taken by phone by the police departments and the sheriff's office. So we are getting phone numbers, and then the police officers call the people back. So at this time, Chief Ardis and I would be welcome to welcome any questions that you might have concerning 911 fire EMS response.
Could you elaborate on the level 1, 2, and 3, and what do those different levels mean? How do you determine what level we're at, and why are we now at level 2?
The 3 levels, we have level 1, we have level 2, and level 3. Level 1 basically means that the system is near normal as far as our response availability. Level 2 means that we have a little bit more short resources potentially, and we vary the responses for level 2. Level 3 basically would be that the resources are scarce and that we try and keep the resources available for the most critical patients. So we would alter the response. We may send a fire vehicle to evaluate the patient, or we may send an ambulance to evaluate the patient, potentially a single agency response to protect the responders and have the resources available for those critical patients.
So if we're at level 2, you say there's a potential for shortage of resources?
Level 2, not necessarily a shortage on the street of resources, but we want to make sure that we prioritize those and do evaluations in the field with some of our response units. The Chief talked about the QRV vehicle. They may do an infield refusal if it's appropriate, and again, potentially keep those folks from going to the emergency department if they can stay home.
So the reason we're at level 2 is just because we have cases in the community, basically.
Right. The reason we're at level 2 is we have some cases in the community, and we're hoping that those don't exceed our ability to respond.
Can you quantify how many calls, say, the dispatch gets regarding coronavirus a day? I know, like you said, 211 kind of handles a lot of them, but is there a way to quantify that number?
On a typical day this time of year, we're probably handling a dozen flu-type calls. About 5 to 6 of those right now are being categorized as the Protocol 36 calls for service. So that would be a normal day for us, would be 8 to 12 calls for the flu, depending on the time of year.
I have a question for Chief Ardis.
Okay.
Are you worried that your staff will be more at risk because people aren't being honest when they call the dispatchers?
Excuse me. So the question was, are we worried that we'll be put more at risk because the callers aren't completely honest? Absolutely. And that's one thing we've stressed very much over our social media page and other avenues is it's not only important for us, but it's important for the law enforcement officers as well. And that's what we've said is regardless of the situation or regardless of the reason you're calling 911, whether it's you or someone in your household, you need to be completely honest with any flu-like symptoms that you've been experiencing. What we've said is it's not going to delay the response. It's just going to help protect us. And so, yes, that's been a major point for us to stress. Again, not only for law enforcement, for ourselves. And getting back to my original comments, one thing that I did leave out that's germane to what you're talking about, Treasurer, is Lauren Emanuelson from AMT and Battalion Chief Tinley have been working very closely with Director Tuttle and his staff to create a database of addresses that we've already responded to with flu-like symptoms, COVID symptoms, and they put that in the database. And that way, even if the caller, for whatever reason, doesn't come forward with these things, that address is already in the system. And so whether it's law enforcement or EMS providers can prepare.
Have you already been on call? Have you already been on a lot of calls so far where you weren't aware beforehand that the people inside of the home or the business have flu-like symptoms?
That's a great question. The question was, have we been on several calls thus far where we are unaware of the flu-like symptoms? Yes, and in all fairness to the caller, there are certain times that the dispatchers are not able to gather that information. It may be because of severe respiratory distress. where they're not able to form a complete sentence, or they're really struggling to even maintain their oxygen levels, let alone relay stuff to the dispatchers. Obviously, if it comes in as a person down, we're not able to gather that information. We have run into situations where even though the dispatchers have asked the proper questions, the caller hasn't been completely honest, and it could be because they think it's going to delay the response, or they think that the providers aren't going to approach them. But for whatever reason, that has occurred. But by and large, it's just been because I mentioned our 3 members who were quarantined March 18th. Again, that came in as a severe respiratory distress call, and the caller was in severe respiratory distress. It may have been a situation where she was so scared about her current respiratory situation, she wasn't even thinking about the questions that our dispatchers were asking. So what we're asking is, please just be completely honest, whether it's yourself or anybody in the household. That way we can prepare. And again, it's not going to delay a response whatsoever.
Chief, on Tuesday, the council did talk about staff reductions. Do you know if at all that would include firefighter paramedics?
So the question is, there was some discussion about possible cuts in the city, and are we aware of any firefighter paramedics to be cut? We're not aware of any specifics. Obviously, with the budget projections and the shortfalls, I highly doubt any department's going to be immune. But I think it'd be premature for myself to discuss anything because nothing specific has come out.
Chief, can you talk about how you guys are doing in terms of supplies when we look at PPE?
So the question is, how are we doing with regards to PPE supplies? Getting back to Jason Marks and Mike Vaughn, they've done an outstanding job. Battalion Chief Tinley has procured a tremendous amount. Division Chief of Operations Sean Sahlberger has been able to get a lot of supplies, especially cleaning supplies. Right now, we're not doing bad. Gowns, we tend to get a little short on gowns. We're doing pretty well on masks and eye protection. But we're going through about 95 masks a week. And so we're just going to continue to pound forward and make do with what we have, and then adjust accordingly.
So kind of a two-part question here. Have you guys been responding to, say, more house fires, things of that nature, because more people are home for all day? And then the other part, have you found yourself responding to less, say, car accidents because not as many people are on the roads?
Sure. So it's a two-part question. One is, do we find ourselves responding to more house fires right now because so many people are in the home? Then the second part is, are we finding ourselves having a decrease in other calls? The first answer is, ironically enough, yeah. And I'm not sure if we can attribute it to the fact that they're home more or what the contributing factor is, but we just had another one earlier this afternoon on Lydia, but we have been responding to an exorbitant amount of residential fires over the course of the last 2 or 3 weeks. Your second question, and just to remind everybody, it was, are we responding to less calls? We have seen a significant decrease in those other types of calls. And again, I think a lot of that has to do with the fact that they're cooped up. So it's kind of one of those things. So we anticipate, obviously, when things start progressing back to normal, that call volume will go back to normal. But right now, and thankfully, actually, our call volume with regards to car accidents or other EMS-related incidents has decreased.
Do you know if there's been an uptick in overdose responses?
No, I actually, we've had probably the normal amount, and I say normal, sadly, of course. We haven't noticed a significant amount. We have been responding significantly more to some psychiatric issue calls. And again, I think this is a tough time. It really is, and that's why the work that Dr. Bender and his group is doing is so vitally important, because we're just trying to get everybody to look past today. We will get through this, and there are so many resources available. So we'll just keep pushing forward and reminding everybody that look out for each other, look out for yourselves, and we'll be okay.
Chief, this is a really grueling time for everybody. I mean, especially if first responders on the front lines of this every day. I mean, what's being done specifically for firefighters who are dealing with the stress and anxiety of all this right now?
Great question. So the question is this is a very stressful time, and what are we doing for our first responders and our firefighters? So we have, on a regular basis, way before this situation even started, we had a very active mental health program within not only the department, but with our state friends. We have members that are part of what's called the AFFI. It's the Associated Firefighters Illinois Peer Support Group. This is a group of volunteer members of the professional fire service that are specifically dedicated to helping members who are suffering, whether it's marital problems, addiction problems, no matter what it is, this is a resource for them to reach out. Firefighters and police officers either commit or attempt suicide at an incredibly higher rate than the normal citizen. And so that's a statistic we are very, very familiar with, and we actively try to deal with. So even before this crisis started, we were very active with regards to reaching out and making sure all of our members know about our employee assistance program, making sure they know who our peer counselors are, making sure they know what resources they have available. And again, it doesn't matter what they're suffering from, we are there and we make sure they know that. Okay, thank you. Monica.
Any additional questions?
Monica, can you detail all the governor's announcement from this afternoon that federally funded healthcare sites, including Heartland Health, are going to expand their testing capacity?
Yes, so the governor during his announcement today made reference to the fact that one of the key aspects of kind of the recovery phase, or when some of these restrictions would be lifted, was when we have abilities to do increased testing. And one of the great partners that are available are our federally qualified health centers that focus in neighborhoods and with populations that are very vulnerable. And so here locally, Heartland Health Services is one of those partner agencies that is looking to expand testing opportunities in some of their different clinic areas, which are within the south side of Peoria, as well as the health department. We are actually are home to a Heartland Health Service site as well.
So would that be all Heartland's clinics? I know there's one in Beacon, at least one in Beacon as well.
I think the question being, will all of Heartland's sites be operational? And I think they're looking at it from various mechanisms. One is to making sure that if they do designate anyone as testing sites, that they're able to then continue regular routine business in other sites. So looking at that model, as well as what makes sense for the population, or looking at even doing a drive-through clinic. So which of their facilities would be best suited for that? I think they're in a lot of discussions right now internally to kind of determine that from all of their sites.
And when does this come online? Do you have any timeline for that? Is it this week, this month?
I think very shortly. I know Heartland Health Service and actually federally qualified health centers have always had the ability to do testing, but the really next step is that increased testing capacity. And so I think the goal is really to get them on board here in the next few weeks.
Do you know if it's going to be similar? I know like Bloomington over there at about 250 tests a day. Is it going to be similar capacity here in Peoria?
So the question being whether or not they'll have similar capacity as the Bloomington's community-based site. And I think that really is going to be dependent on just the amount of supplies available. Recognizing the fact that the Bloomington site, that community-based site, is still a federal assets that are being utilized and performed from the state side. The federally qualified health centers will be using state assets themselves. And so, again, there will be some limitations in the amount of numbers total.
And would this be like a walk-in clinic? Would you need a doctor's referral?
And the question being whether it be a walk-in clinic or whether or not wanting a doctor's referral. And I think the biggest key about this is that testing, regardless in our community, is going to be based on symptoms. People need to have those 4 main symptoms or in some variation of them. Again, because you want to have enough of a viral load so that your test comes back either more accurately. Otherwise, we're fearful of having those false positives or false negatives. And so not necessarily whether or not it needs to have a physician referral, but you definitely wanting to have symptom-based.
So I know, like in Bloomington, for instance, sorry to bring them up again, but they have different levels of, if you're a healthcare worker or first responder who's more prone to exposure, you can go there to get testing, or if you have certain amount of symptoms, you can also go to get testing, even if you're not somebody who's actively working in an essential position. I mean, is that kind of what we're talking about here?
So the question is whether or not there'll be prioritized testing similar to the Bloomington situation. And with the Illinois Department of Public Health lab testing, those priorities actually match up with the community-based testing that's done in Bloomington. So again, if they're using the state-based testing capacities, they're going to have very similar prioritization standards.
Will there be any cost to the citizens or insurance coverages?
So the question whether or not there'll be any cost to the citizens or the insurance coverage. In fact, the CARES Act came out and actually did have testing covered as part of it for COVID-19 specifically.
Monica, for maybe some people who were listening who maybe didn't listen to the governors, could you detail kind of what would be happening here and how it would be different from that McLean County site?
So the question is, based on what the governor announced today, how will that actually be implemented here locally? And really the governor was focusing on the fact of increasing testing facilities and looking at our federally qualified health centers, which focus on vulnerable populations, to be able to expand their testing. And so that would be looking at Heartland Health Services here locally. Now, the distinction between how it will be delivered versus the Bloomington drive-through clinic is really best directed towards Heartland Health Services. I know they're in discussions right now to see what kind of mechanism and method they're going to be utilizing, but I know that they are looking at what best serves the public in general.
With increased testing, is it just sure as fact we're going to have more cases come about?
So the question is, with increased testing, will we see more cases? And yes, again, whenever you're able to increase your testing, you're increasing diagnosis and understanding the surveillance of a community. And so I think many of the governors, especially in the Midwest, were talking about when they can go back to kind of relaxing those regulations that they have in place. And the big common thread was increased testing, understanding from a surveillance aspect how much of our population has been exposed, has had symptoms, or currently has symptoms, so we know really where we sit and know that when we do return, the likelihood of having either a secondary increase as well based on the numbers. So again, testing is always going to be our best tool in terms of an outbreak like this. Well, thank you, everyone. We will see you tomorrow.